So my name's Sabrina Phillips. I'm an adult congenital heart disease specialist here at the University of Oklahoma. Congenital heart disease is an alteration in the structure of the heart that happens when the heart is being formed. So patients are born with their congenital defect. And there are many congenital defects, but about 1 in 100 babies is born with an alteration in their heart that is significant and needs care. This complicated organ that is so important to life starts out so simple in how it's made. It starts out as a single tube of cells. Adults with congenital heart disease face unique health challenges throughout their life, but they can live good and fulfilling lives, including doing many of the things that we take for granted. Having a pregnancy and delivery, most of our moms with congenital heart defects, if they have specialized care and good follow-up, can safely have a pregnancy and delivery. The normal heart has 4 chambers. 2 upper chambers that receive blood from veins and 2 pumps that are the bottom chambers that pump blood to the great arteries. So you can imagine that anything this complicated that has this many connections, there's a chance for something to go wrong in the blueprint so that the heart is not formed completely normally. And so the most common complication or congenital abnormality that we see would be a hole between the bottom chambers or the pumps of the heart. We call that a ventricular septal defect, or a VSD. We can have a hole between the top chamber, an atrial septal defect, and we can have alterations in valve function. The heart can even become more complicated in terms of any congenital defect, and we might have really no formation of one of the pumps so that a patient is left with a single pumping chamber. So you can imagine any permutation you can think of we have seen with congenital heart defects.